I don't want to have to record this. Really, I don't. Let me explain. I live in the United States, and as a country, we're in a really weird place right now. I'll be the first to acknowledge that we are privileged in many ways. I can put my kids to bed with relative certainty that our house won't be leveled overnight. I have access to food, clean water, high-speed internet to upload this content for you. But in addition to many other things, we are in the midst of a presidential race. One candidate is a convicted felon that is testing the very limits of what we can call democracy. The other says stuff like this.
Making sure that we continue to strengthen our healthcare system, making sure that we're able to make every single solitary person eligible for what I've been able to do with the COVID. With dealing with everything we have to do with. Look, if we finally beat Medicare.
Thank you, President Biden. President Trump?
Now, there is plenty of commentary and content out there criticizing both presidential candidates, but I feel that I have a special obligation to put my thoughts out there because of my profession. There has been a lot of speculation online about Joe Biden and whether he's showing signs of dementia. I get the concern. If you wouldn't want to be behind the wheel with somebody in their car, why would you want them running your country? But very few people that I've encountered online are actually qualified to make much commentary about the cognitive abilities and mental fitness of Joe Biden. As a neuropsychologist, my job day in and day out is to help determine whether people are experiencing cognitive impairment. I've even written a book about dementia. So what I'd like to do today is help answer the question, does Joe Biden have dementia? Stick around and I'll also give you my personal perspective of how I would approach this case if I saw Biden in my office, and I'll let you know if I think he does have dementia. At the beginning, I said I hate that I have to record this. Now would be a good moment to speak on that a bit and also discuss my bias coming into this. Personally, I am a very liberal person. I work within a helping profession. I'm a queer man in a non-monogamous marriage. I'm married to a woman of color. There are many elements that, from my perspective, it shouldn't be surprising that I lean toward the left. Aside from the occasional primary, I've voted for the mainstream Democratic nominee in every presidential election that I've been able to vote in. Honestly, though, I don't know what I'm going to do this time around. And that sucks. I don't like feeling that way. I'm not going to totally get into it here because that's not what this video is about, but I do need to be clear that my issues with Biden go beyond just the topic of this video being his cognitive fitness. Similarly, there are other politicians that have also gotten attention and have questionable cognitive functioning and questionable ages. So we're not going to talk about all of that. I'm focusing on this specific aspect here. I also need to be absolutely clear that I'm not trying to diagnose anyone here. This is just meant to be educational. I'm using Biden as a prompt to teach you more about these topics so that you can inform your own opinion. It's not possible to make a diagnosis of something like dementia without having a significant amount of hands-on time with the person and having access to more information than any of us schmucks have on the internet. I suppose that the best place to start would be actually defining dementia, because most people that are not in the medical field, and some that are, actually don't know what the hell dementia actually means. Dementia is not a disease. It's also not something that happens to all old people. Dementia is essentially just a category of functioning. Dementia means that somebody has cognitive impairment, so impairment in their thinking skills, and it's so significant that it's preventing them from functioning independently in their life. That's all that dementia means. It doesn't imply a specific cause of that dementia or which cognitive abilities are impaired. It just says that somebody fits that category. They're so impaired that they're not able to function well. Dementia is not part of the normal aging process. Essentially, you have a spectrum. On one side, you have normal aging. As we get older, things change. Biden is 81 years old. He's inevitably going to experience some changes as compared to when he was younger in terms of how well his brain is working. Anybody in their 80s will. Changes that are expected for somebody's age are not considered problematic. That's just part of getting older, and we expect that. On the other side of the spectrum, you have what we call dementia, which is what we just defined, significant cognitive impairment that impacts functional ability. In between those two, you have something that we call mild cognitive impairment, which means that somebody has some cognitive impairment. It's not just normal aging, but it's also not so severe that it causes that impairment in everyday life that we would say leads to dementia. So all of this begs the question, what category do Biden's difficulties place him in? Is he at the level that we would call dementia? Does he show signs of mild cognitive impairment? Or is he simply a normal old dude? Joe Biden's 81 years old. In your 80s, you're supposed to operate differently than you did when you were in your 20s or 30s. There are some normal and expected declines that happen as you get older. But let's remember, dementia is not part of the normal aging process. That would mean that something went wrong along the way. So let's talk a bit about what that normal aging process looks like. What is a person in their 80s supposed to look like? First thing to talk about is processing speed. Processing speed is the term that we use to describe how quickly you think. When you're trying to remember the name of a movie that you watched in the theater, the last thing that you saw in the theater, processing speed is what helps you bring that up quickly. When someone has trouble with processing speed, I've heard it described as feeling like there's molasses in the brain. The thoughts are there, but they just don't bubble up to the surface very quickly. If you've had COVID-19 during this pandemic, you may have gotten brain fog. And for a lot of people with, what they would consider brain fog, you actually do see a change in processing speed. Maybe trying to think of the last movie you saw in the theater takes you a minute. You go, oh yeah, it was, what was it? I was with my wife and we got dinner afterward. Oh, it was Inside Out, right? I haven't seen the new one yet, but I've heard it's great. But yeah, so it takes a minute to come to you, and that is a byproduct of potentially slowed down processing speed. And as we age, the myelin, which is the fatty stuff surrounding the neurons in our brain, it starts to break down a bit, which actually slows the speed of the signal that travels through that neuron. So your brain is actually working more slowly on an electrical basis. And then you also have what's called white matter disease or chronic microvascular disease. Microvascular meaning the really small blood vessels in your brain. If you've ever had an elderly relative, you may have noticed that their skin bruises more easily. They bump into something and might get a big old bruise, whereas they used to be able to handle that more easily. That's because the blood vessels in your body, they become less stretchy, less elastic, and they're more prone to breaking. So if you get an MRI scan of an elderly person's brain, you can see little white spots that pop up. And these are small areas of ruptured blood vessels or blockages leading to reduced oxygen. By themselves, they're not cause for concern. They don't cause any major difficulties like a full stroke, a hemorrhage, something like that. But as they add up, especially in the interior, the middle part of your brain, which we call the subcortical, under the cortex part of your brain, it can slow down the efficiency of your brain. Basically, the way I like to describe it to patients is that it causes traffic jams in all the interconnections of the brain. And the result of this is that you start to slow down in your thinking speed as you age. That's probably the most significant thing that changes as you get older that's expected. This processing speed reduction also can lead to memory lapses in older adults. But rather than true memory loss where the information is completely gone, you tend to see a reduction in the efficiency of the memory, how quickly it's working. So this might lead to things like walking into a room and forgetting why you walked in, or losing the word you're looking for or the name of something while you're speaking, maybe even not immediately remembering a recent event. But typically, the memory returns with some time or with a hint. For example, when you retrace your steps after walking into a room, you might go, oh yeah, that's right, I was going for this thing. And that's a sign that the memory was there, but it just wasn't coming quickly enough. Or you might find the word that you're looking for a minute later. Maybe you remember that you watched a movie already because when you turn it on, you go, oh wait, no, this is familiar, I did watch it. And then it comes back to you. These would all be age-appropriate memory changes that happen later on in life. The last major change that I'm going to say that is considered normal for people going through the aging process is a mild reduction in what we call executive functioning. These are higher level thinking skills associated with the frontal lobes of the brain. And these are things like multitasking or adapting to new situations, filtering out distractions. This is one that probably influences some of those stereotypes of older people being stuck in their ways, not wanting to adapt, because older people legitimately have trouble adapting to new things. If you've ever gotten a grandparent or an older parent a new TV, for instance, they probably had a hard time figuring out how to use it, or a new car, or if they moved to a new city after living in the same place for a very long time, it may take them a while to adapt to that and get their bearings. These are all normal things. And when somebody is aging normally, they usually adapt their lives accordingly. For instance, older adults tend to drive slower. This gives them a chance to compensate for the reduced processing speed. They might also reduce the complexity of their lives as well, sticking more to routine or even downsizing their home to make things more simple. All of this is normal and expected for somebody in their 70s or 80s, sometimes even later 60s. Now, most people in this age range, 70s, 80s, are retired, at least here in the United States. And in most cases here, retirement age is around 65. Think about that for a second. 65. Most normally functioning people of any age would have trouble running a country. It's an extremely demanding job, and that doesn't fit well with the normal aging process, let alone somebody with actual cognitive impairment. Certain jobs just require higher cognitive functioning, and this is something that needs to be kept in mind when you consider how somebody's functioning. I see people all the time in my practice that think they're getting dementia and they're super worried about their functioning. But when I dig into their situation, it's simply that they're a normal 85-year-old and they're still holding themselves to the standard they did when they were maybe 50. Maybe they're managing a huge real estate portfolio, trying to do all the paperwork, property management, customer service, all of that themselves. And that's just an unrealistic expectation for an elderly person. Now, I want to get more into this, and I'm going to get into some examples of what I've seen from Biden. But before that, let's take a quick break and talk about our sponsor. This episode is brought to you by BetterHelp. One of the areas in my personal life that I feel like I've made a ton of progress over the past couple of years is comparing myself to others. These days, with social media shoving idealized versions of lives, bodies, and careers in your face, it can be really hard to keep a level head. Through a lot of self-reflection, I've come to a place where I can much better recognize that somebody else's beauty or success has absolutely nothing to do with me. Life is not a zero-sum game. I can have mine, they can have theirs, and they can be completely independent. So if you feel like you're in the trap of envying other people's lives, you might consider reaching out to a licensed therapist through BetterHelp. All you need to do is fill out a brief questionnaire, and that will get you matched with a licensed therapist. It's entirely online, and it's suited to your schedule. You can also switch therapists at any time for no additional charge if you don't hit it off right away. So stop comparing yourself to others and start focusing on you with BetterHelp. Visit betterhelp.com/deaf for 10% off your first month. That's betterhelp.com/deaf. Okay, let's get back to the good stuff. So when I'm approaching a situation like this clinically, another important thing to consider is the basis for comparison. In the cognitive tests that I administer, like a language test or a memory test, these are normed tests. So that means that they have a set of data for what would be considered normal and abnormal for a given age and education level. And that can be very helpful, but it doesn't help us understand how somebody compares to their own previous level of functioning, unless for some reason we have a baseline because they were tested in the past. And in some cases, people come from super high baselines. It's clear that they have been historically above average. They've always been somebody that excels in their career. They did great in school. They worked in a very cognitively demanding job. And people knew that they were just very, very sharp, more than the average person. So in these cases, even a score that's in the normal range might still mean that personally they've declined from the way they used to function. So with Biden, some of the data that are available to us are examples of his functioning over the years, which may show a substantial change. It's a really unique situation because so much of his life being a career politician has been recorded. So there's actually a record for us to look at. So let's get into the juicy stuff and compare some examples. Here's the first one.
There's nothing noble about this, but ask yourselves the question, would you want a job that, in fact, every day you had to get up and you had to modulate what you said and believed? If you're going to run, you're running for a reason. You want the job for a reason. And if you can't state why you want the job, then there's a lot more lucrative opportunities other places.
I can't imagine what it would be like to spend 9 years pretending to be somebody that you're not. No.
In this clip from 2015, we can see that he's formulating sentences pretty well, using a decent vocabulary, and he doesn't seem to be reading from a script. It's all off the top of his head. He also includes things like his own humor, and he seems to pick up on the joke that Stephen Colbert was throwing out there as well. So to me, this doesn't raise any red flags for anything beyond just somebody who's getting a bit older. Looks pretty normal to me. Let's look at another one.
It's about time they take some responsibility here. And instead of signing pledges to Grover Norquist not to ask the wealthiest among us to contribute to bring back the middle class, they should be signing a pledge saying to the middle class, we're going to level the playing field. We're going to give you a fair shot again. We are going to not repeat the mistakes we made in the past by having a different set of rules for Wall Street and Main Street, making sure that we continue to hemorrhage these tax cuts for the super wealthy. They're pushing the continuation of a tax cut that will give an additional $500 billion in tax cuts to 120,000 families. And they're holding hostage the middle class tax cut because they say we won't continue the middle class tax cut unless you give the tax cut for the super wealthy. It's about time they take some responsibility.
Now, this was also an earlier clip. This was from a vice presidential debate between Biden and Paul Ryan in 2012. And in this clip, we can hear he's fired up. He's emotional, but he's not losing his train of thought. And he's also pulling in information like statistics without tripping over the numbers and names that he's trying to pull up. His speech isn't world class, but again, I'm not seeing any red flags for an older man. So this gives us an idea of how Biden was doing in 2012, 2015. Let's take a look at how he is now in 2024.
Look, I've turned around the horrible situation he left me. As I said, 15 million new jobs, 800,000 manufacturing jobs, more investment in America, over billions of dollars in private investment in enterprises that we are growing. By the way, we brought an awful lot of people, the whole idea of computer chips. We used to have 40% of the market. We invented those chips, and we lost it because he was sending people to find the cheapest jobs overseas and to bring home a product. So I went to South Korea. I convinced Samsung to invest billions of dollars here in the United States. And guess what? Those fabs, they call to build these chips, those fabs pay over $100,000. You don't need a college degree for them.
Here we can see Biden starting to struggle with retrieving the words that he's looking for quickly enough. And he seems to be having some difficulty maintaining his train of thought. He gets sidetracked a lot and he has to wait for a moment and really center himself, which is a great tactic, but it's obvious in this setting. Let's look at another one.
I'm pleased to award you the highest civilian honor the United States can bestow, the Presidential Medal of Freedom. Ask a military to come forward. And ask him to read the citation.
Now, this one was a recent speech at the NATO summit. And in this one, you can see somewhat different difficulties. In this speech, he was reading off of teleprompters, which helped him quite a bit. He didn't have any of those word retrieval issues or get really, really sidetracked. But he did seem, to me at least, to have a little bit of executive functioning trouble, as he was actually reading some things that he wasn't supposed to read. He was reading some of the stage instructions that weren't part of the speech, like ask him to come forward, ask him to read the citation. These are things that were probably in brackets or a different font. And this is a moment where that mental flexibility comes into play, being able to adapt on the fly, being able to switch demands, and be just cognitively flexible, which is very important for a person operating in an office like the president. We also need to keep in mind that Biden has probably read off of hundreds of teleprompters in his life, so this presumably isn't an unfamiliar situation for him. Let's look at one more.
By many accounts, as evidenced by video footage, observation, and interviews, Mr. Biden is not the same today as he was even when he took office 3.5 years ago. Similar reporting in the Washington Post and the Wall Street Journal. Are you the same man today that you were when you took office 3.5 years ago?
In terms of successes, yes. I also was the guy who put together a peace plan for the Middle East that may be coming to fruition. I was also the guy that expanded NATO. I was also the guy that grew the economy. All the individual things that were done were ideas I had or I fulfilled. I moved on. And so, for example, well, that was true then. What's Biden done lately? Today, just announced 200,000 new jobs. We're moving in a direction that no one's ever taken on. I know you know this from the days in the government. I took on Big Pharma. I beat them. No one said I could beat them. I took on all the things we said we got done. We were told we couldn't get done.
Okay, so this one was in the interview, the one-on-one with George Stephanopoulos after the presidential debate. And Biden stumbled at times, but it certainly wasn't as egregious as it was during the debate performance. One thing I did want to point out here, though, is the sort of sidestepping and potentially the denial that we're seeing. When Biden's asked a question about his age, he doesn't exactly answer it. He redirects to other claims. Now, I'm sure there's some people, on the far opposite side of the aisle that will say he's just being delusional about all these claims. And I don't think that's what's going on here. Maybe a bit grandiose, but he's a politician, right? Really, this reminds me of when I ask somebody whether they're having issues with their memory, and they start telling me about all the things they can do or all the things that they've done in the past rather than answering that question. So I might say, are you having any problems with your memory? And are you having any cognitive issues? And they say, what? I was the head of the biggest bank in the West Coast. I managed so many people. Why are you asking me this? I can make my own food. I make my own breakfast. I go to the store. This is dumb, right? So sidestepping it. One sign of dementia, right, the far side of the spectrum where somebody is really, really having impairment, one sign of that is a lack of insight, meaning somebody actually can't see the problems they're having. They're not being stubborn, but they just are unable to recognize that they're having issues. I don't think that's what we're seeing here. This is more likely denial, which means he has some awareness, but he's just trying to talk around the topic instead of acknowledge it directly. And this is what you would see more commonly in people who are in the more mild cognitive impairment stage. Obviously, though, through these clips, we can see some change. But we also have to keep in mind this is a skewed perspective. This is what the media presents to us. There's no doubt about these instances happening at very inopportune times, but we do have an incomplete picture. We don't know what he's like in day-to-day life. We don't know whether his cognitive performance or ability level tends to fluctuate throughout the day. Stress is a factor. I've certainly gone blank during situations that were extremely anxiety-inducing. I remember back when I did my TEDx talk, I left out an entire chunk of my speech just because I was so nervous, and I only realized it after it had already passed. So things like this can definitely happen to anybody, but despite the fact that anybody could crack under the kind of scrutiny and pressure that Biden is under, it's important to remember this is not a new situation for him. He is a career politician. I think he was one of the youngest people to be, elected to the Senate. I could be wrong about that. He's somewhere in there, but he's been doing this for a very long time, and he's been in the limelight for a very long time. So we actually do have some basis to compare these issues with his more recent appearances. Biden clearly has more trouble finding the right words now, and more trouble quickly coming up with responses and keeping his train of thought while he's speaking. He seems like he might also be more easily thrown off track and demonstrate what we call changes to mental flexibility. That is the ability to adapt on the fly, to juggle multiple thoughts at once without losing your place. He's also simply changing in his presentation, how he looks and sounds. He slurs his words a bit more, and he does seem to be struggling a bit more with speech production. Though this could be due to physical things. He has had teeth work done. He's had face work done, apparently. That's what it looks like to me. And obviously he's getting older, so there's some physical deterioration that can happen. So I don't know that the speech is necessarily a brain issue, but these are all pieces of the puzzle. So does this mean that Biden has dementia? Does it mean that he has mild cognitive impairment? We really can't be sure with the limited scope that we have as bystanders. When we talk about change in somebody's ability to carry out daily activities, typically being president of the United States is not part of that equation. If I were involved in his care, I would want to know about his functioning in other domains. Is he able to remember birthdays of important people in his life, like family members? Is he able to keep track of his medications independently? Is he able to navigate without getting lost? You can probably see how this would be complicated and difficult to address in a sitting president, because basically he isn't allowed to do any of these things on his own. He has somebody who's telling him what his calendar is. He has somebody probably who's, helping him with anything medical. He's being driven everywhere and not really in a chance that he could possibly get lost. So it's really hard to detect these things in someone with this unique situation. Now, let's say that the concerns about Biden are legitimate, and he's definitely showing signs of cognitive impairment and a decline in his abilities. Another important determination would be what is causing that impairment? Why is he showing that type of impairment? We talked about vascular changes in the brain that are part of the normal aging process. Well, for some older adults, you have more extensive vascular disease, and this is often tied to health factors like high blood pressure or unmanaged diabetes. Beyond that, you can have significant events like a stroke, a brain injury, a seizure. These can all cause damage to the brain. Diseases like cancer or Parkinson's disease or MS, these can all cause cognitive impairment. And of course, you have then progressive brain degeneration like Alzheimer's disease or frontotemporal dementia. So if cognitive impairment is present, it's really important to do the work of figuring out why, because these all look different in terms of their effects, and they have different outlooks. Some of the things that I mentioned are relatively stable. They're not going to inevitably get worse. Other things are considered progressive conditions, and there's an inevitable downturn that happens, which is really important to know. So let's say I'm sitting here and I get a call on my phone, and it's the US government, it's the White House, and they're like, Dr. Duff, we need you to come out here to the White House immediately and conduct a thorough neuropsychological evaluation of President Biden. I would be like, all right, fork it over, pay me. And then here's how I would approach it. First off, I would interview him as well as other informants, people like his wife or coworkers that have worked with him closely for years. In addition to asking about cognitive difficulties and any changes that they notice, I would also obtain a thorough family history, see if any of his family members, like aunts, uncles, parents, grandparents, have had any cognitive difficulties, any neurological issues. I'd also ask about any notable medical events, sleep quality, because sleep is very much tied to memory, mood, all sorts of things like that. There are many questions other than just the direct memory questions that we ask in a thorough evaluation. Then I would do the evaluation. I would conduct a thorough neuropsychological assessment battery. And I need to be clear here, this is not the kind of cognitive assessment that Trump was bragging about passing a few years ago. That drove me crazy. He was like, oh, I aced that. He was talking about the MOCA, which is the Montreal Cognitive Assessment. It's just a brief screener. It is out of 30 points. It involves things like remembering a few words, doing a trails exercise, identifying some animals, just a bunch of little tasks. And the idea there is just to rule out major difficulties. What we're talking about here for a thorough neuropsychological evaluation is at least 2 to 3 hours of comprehensive testing, looking at memory, attention, reasoning ability, processing speed, language, executive functioning, visual spatial skills, emotional functioning, sometimes even more than all of that. So we would be very thorough with it. From there, I would also want to get medical records, blood work to rule out vitamin deficiencies, which can change mental status, information about chronic illnesses he might live with, and an MRI or a PET scan of the brain to see are there physical signs like shrinkage of the brain, which we call atrophy, or vascular issues. Are there areas of the brain where we're seeing decreased activity? All of these things are important. And this would give me enough information to interpret the test data and hopefully determine whether he's experiencing a problematic level of cognitive change and why that change has occurred. Let's say he had Alzheimer's disease. I would expect to see trouble with short-term memory tests that we do. I'd also expect to see maybe some changes to language functioning, but typically his attention span and his processing speed would be totally fine. If he had Parkinson's, the profile would be different. It would be more influenced by slow processing, and then that would have some secondary impacts on other skills like memory. But all of these issues follow a different pattern. It's not all one thing. So what's my final answer? Do I think that Joe Biden has dementia? No, I don't. Not at this moment, at least. From my clinical experience, I'd be very surprised if he was all the way at that dementia stage. However, I am concerned about the trajectory of what seem to be declining cognitive abilities. If he's experiencing a progressive condition, say it's Alzheimer's disease or something like that, I can't say that it is right now, but if it is, then things are going to look pretty bad in 4 years. Right? If I encountered Biden in a clinical setting, I would definitely want him to undergo a thorough evaluation to investigate the issues that are already apparent on the surface. I wouldn't be able to make any immediate assumptions about what's going on there, but I'd be curious and a little bit concerned. But, and this is a big but, at a certain level, it doesn't matter if Biden has dementia. It doesn't matter if he has mild cognitive impairment or just a series of momentary lapses. We're not talking about a basic job here. We're talking about the President of the United States, a job that has incredibly high demands and stakes. One of the biggest concerns that I have with elderly people holding this job is just how fast-paced it is and how adaptable you have to be. These are difficult things for somebody in their 80s. So whether you're a fan of his politics or not, I think it's completely valid to be concerned about Joe Biden's cognitive health. It's very tricky territory when it comes to things like age discrimination in a job and privacy. Would I like for him to have a full cognitive evaluation? Absolutely. Do we have the right to know the results of that evaluation? Probably not. There's a lot of transparency requested for presidents, which makes sense. But when there's no established system for measuring the mental fitness, mental competency for office, that can be a very slippery slope. And as we've seen, laws, regulations, these things can change easily sometimes. In other fields, there are guidelines related to competency. I've done exams for pilots for the FAA or surgeons for the medical board in my career to establish whether they have the cognitive ability and the capability to perform their high stakes jobs. If I were asked to complete a fitness for duty evaluation for the president, I don't know what the results would be. And I'm being honest about that, not trying to be controversial. It could go either way, but I certainly wouldn't assume that it would go in a positive direction. So those are my thoughts about that. I really, really appreciate you joining me in this episode. If you have questions, you can message me on any social media. You can leave comments in the YouTube comment section. And I hope that this gives you a better idea of what normal aging is, how that differs from dementia, and some of the concerning signs in our current president. Now you have a more informed perspective from which you can make your own opinions and decisions. Take care of yourselves. Bye.